Welcome, everybody. It's really nice to virtually see you. The webinar that I'm going to give you today is called Community Engagement Beyond the Advisory Board, How to Do It and How to Measure It. I'm going to start by introducing myself. I will tell you a little bit about the Institute for Community Health, my organization, and then we will get right into our topic. I will add that I very much welcome questions via chat at any time. I will stop every couple of slides and just check the chat to make sure that I'm not missing anything. And at the end, if you want to stick around once we're done, I will take people off mute and see if we can manage a vocal discussion. But for the presentation, for the purposes of the presentation, we will stick with chat for now. Again, welcome. Welcome to people who have just joined. I'm going to start with introducing myself. So my name is Carolyn Fisher. I often go by Carrie. I'm a research and evaluation scientist at the Institute for Community Health, and I also teach in the Tufts Medical School's Department of Public Health sometimes. My background is in cultural anthropology, and partly because of that, my favorite methods are qualitative, though I also do mixed methods, and I work with quantitative folks here at the Institute for Community Health. Generally, my topic interests include working with vulnerable populations, trauma-informed data collection, behavioral health and healthcare, advocacy, and, of course, community engagement, and that's what we're here to talk about today. My current projects involve a really wide range of topics. They include evaluations of projects that support parents to advocate for their children's special healthcare needs. They include increasing testing and treatment for latent tuberculosis infection, organizing consumers to advocate for changes in the health and healthcare system, educating early childhood educators to better serve vulnerable families, and treating children and youth with histories of trauma. Those are some examples. It's not a comprehensive list. I see there's a question, will slides be shared with participants after the presentation? Absolutely, yes, they will. Thanks for asking that. So I just want to also add that with all of these topics, community engagement is important in a wide variety of ways, but is important to all of these projects. So briefly about the Institute for Community Health, ICH is a nonprofit consulting organization. We offer 4 main services, like you can see on the slide: participatory evaluation, applied research, assessment and planning, and data services. We work with clients across a range of sectors, including hospitals and health centers, public health departments, schools, foundations, and a wide variety of community-based organizations. Across all of our services, our goal is to help our clients find ways to use data to improve the services that they're offering and ultimately to maximize the impact that they have on community health. As a qualitative person, I feel the urge to say that when we talk about using data, that includes qualitative data as well as quantitative data. So today, we're going to be talking about 4 main topics. We're going to start with exploring why community engagement. Why is it important? How it relates to individual outcomes, organization goals, and community outcomes. Next, we'll talk about defining community. And as somebody with a background in anthropology, I get really excited about the word community and about definitions of community. I'm going to try to sort of hold myself back here, but in general, I feel like defining community really helps us sort of drill down in terms of what it's important, what we're actually talking about, because it's a word that really has a wide range of meanings. Next, we'll talk about doing engagement. We'll go through a couple of different types of principles of engagement, ways of thinking about the depth of engagement, and some promising practices from some of the projects that we have been working on around here at Institute for Community Health. And then finally, we'll talk about tracking and measurement. We'll talk about potential measurement techniques. We'll talk about how engaging and doing and measuring can be all part of similar projects. And we'll talk about measuring the unforeseen, which happens a lot when you get out into the community. So first, why community engagement? And I will also just let you know that I would really love for you to actively participate and do some thinking and respond via the group chat. Because this will be more interesting if we can talk about your experiences and your projects, not just the ones that I am already familiar with. So I'm going to encourage everybody to think right now, as I go through the next couple of slides, about a question, which is, why does your organization want to do community engagement? What does your organization hope to get out of community engagement? You can start sharing right now by chat, or you can think about it for a couple of seconds and then share. But I hope that you'll consider sharing, why does your organization want to do community engagement? And while you're thinking about that, I'm going to give you a second or two to think about it, and then I will go through some categories of why people might do community engagement and types of answers that I have heard. So one reason why organizations want to do community engagement is because they want to cause change in individual community members. That could be change in behavior, change in knowledge, change in beliefs, change in various ways of interacting with the world and in interacting with other things. So changing individual community members. Another reason is to work on changing overall conditions for the community. So not just one person, not just their knowledge, but the overall conditions for the entire community, however you define that. A third is to cause change in your organization, to make your organization stronger, to make your organization more responsive for various reasons. It could be to change things about your organization. Thank you for those who have responded by chat already. Thank you very much for that. And while the rest of you are doing a little bit of thinking about it, I will share with you some answers that I have heard from organizations in the past. Great, thank you. So some types of answers I've heard in the past are to ensure the project is responsive to community needs, to change health-related behavior in the community, to earn votes or to change votes, to connect an advocacy ask with a real-life experience for fundraising purposes, to increase acceptance or to lower resistance to an intervention, to increase participation in the project, to increase awareness about an issue, and to increase the number of volunteer hours available to an organization. So as I start to read out the answers from the chat, if you haven't gotten a response, if you haven't shared a response, you can continue to think about it individually in terms of, why does your organization need to engage community? What goals does your organization want to accomplish through engagement? And what does success look like for your organization? This last question is something that we as evaluators at ICH are constantly asking. What does success look like? We have Callie Hess, and apologies if I get your names pronounced wrong. Callie Hess writes that it's the only way we can create lasting systems level change. Absolutely. R. Hecker writes, we want to make sure that we are actually addressing the needs of the community, that we have good representation of the whole community, and we want buy-in. Absolutely. So it looks like this first response is about changing the community, changing the structural conditions of the community. The second one is changing the project, so making sure that needs are being addressed. and changing the community in that there is buy-in. This third one, S. Jalbert, says to help us assess cultural knowledge and expertise from community members. Yeah. To access cultural knowledge and expertise from community members. So to improve the project, right, by figuring out things that we are not necessarily already experts in. Catherine Brooks writes, our organization cannot know all of what is needed, right? So to improve, again, our work by understanding what else is out there. And then finally, to find out where the needs are and troubleshoot how to address them, from P. Tattersall. Thank you. Yeah. So lots of good reasons to do community engagement and many different reasons about how to do community engagement. So it's not all one thing, right? I encourage organizations to actually draw it out, to make maybe even sort of a logic model. One project that I helped last May with this issue, we spent actually a couple of days together, and they already had a lovely organizational logic model. But what we did as part of this community engagement work is we zoomed in on the one piece of their logic model that involved community engagement. And we made a new logic model that started with the things that they were doing to do community engagement and ended up with what they wanted to accomplish via community engagement. And of course, there were a lot of other things involved in their project as well. But this zoomed in logic model really helped us to kind of tease out what we wanted to accomplish with community engagement, and therefore how to do it and how to measure it. Great, thanks everybody. So next we'll talk about defining community. So community is a heavy word. What I mean by that is that the word community, it carries a lot of definitional weight. There are a lot of different uses that people put the word community towards. So some of them, I mean, in the past, community has meant the opposite of nobility, like there's the commoners and then there's the noble people. So community means like common. The quality of owning or holding something together, like the commons, meaning a little like the Cambridge Commons, where people used to graze their sheep if they didn't have enough grass for themselves. Community also means direct personal relations, and that's contrasted with kind of impersonal society or government. And that's the definition we're sort of pulling on when we talk about community organizing among people with direct personal relationships. The most relevant definitions for our purposes, though, are a group of people who have something in common, the people who live or work in a district or an area, so a geographical location. Community can mean social groups whose members identify with one another. So that's what we mean when we sort of talk about the community of Star Wars fans or the community of cheese lovers or something like that. And then community can also mean a particular quality of a relationship with one another. It's important to note, so Raymond Williams is a cultural theorist, and he wrote, unlike all other terms of social organization like state, nation, society, etc., the word community seems never to be used unfavorably. Like, you're not going to have anybody out there who's saying, I am anti-community. You have plenty of people who say, I am anti-state, I am anti-nation, but community is something that everybody is in favor of. So we get a certain amount of sort of warm fuzzies along with our strict definitions when we're defining community. So as I'm going through the next couple of slides, I'd like to invite you to think about, for the purposes of your organization, what do you mean by community? What community are you talking about? Which group of people are your community of focus? So the question is, what is the universe of people you're working to engage? By the way, I am fully aware that this graphic here is a galaxy, not a universe. Trying to be a little bit precise with that, but it's hard to find an image of a universe. So what is the universe of people you're working to engage? And that means, like, where are the outer boundaries of all the people that you're interested in? And then within that universe, like, what are the characteristics of people which are relevant to how they will be engaged in your project, how they'll participate, how they will interact with your project. And I think it's important to know that all the characteristics that are relevant to shaping people's life experiences that are going to shape the perspective that they bring, a lot of those are unknowable, right? We can only do our best. The goal for community engagement, though, is usually to get a full range of representation. And so depending on your project, some characteristics may be more relevant to people than others, to some projects than to other projects. For example, for a project that's working on increasing the amount of physical activity that pregnant women get, the urban-rural divide would be a really critical type of division among that population. For a project trying to promote healthy internet usage, maybe the urban-rural divide would be a little bit less critical. So I'm sure you can drop in many examples of your own, but some types of experiences, some types of perspectives that you might want to think about are here. And there are many, many, many others, I'm sure, that, I'm absolutely certain are not here, but this is just a brief sampling of some of the most common ones. So some of the things that you might want to think about in terms of how the variation within your community will shape people's perspectives include education and experience with that, race, ethnicity, parental status, language, and whether or not the language that is spoken is the dominant language where they're living, religion, immigration status, gender identity, socioeconomic status, age, whether they live urban, rural, or suburban, the geographic area of their residence. All of that can kind of be subsumed under life experience, but it's important, I think, to tease it out. So I wonder if anybody here would like to share in the chat what they are thinking about in terms of how does your community, how do you define the community that's interesting to your project? So feel free to share that now in the chat. Once you have a clear idea of what your community is and then how it breaks down in terms of various types of life experience and identity, then you want to ask yourself, what does the community look like in terms of these relevant characteristics? Are there a whole lot of people who are Star Wars fans and only a couple of Star Trek fans? Are you gonna try to have the people who represent your project being mostly Star Wars fans, and just a couple of Star Trek fans, or do you feel like you do need to kind of oversample your Star Trek fans to make sure that you get Star Trek perspectives in your project? These are very important distinctions, definitely. So feel free as we move along to describe in the chat what your you always want more Star Trek people. Yes, maybe. But as you move along, feel free to describe what the community that your organization is, what that looks like. So when you have an idea of what the community looks like in terms of these relevant characteristics, you can start with that kind of as your benchmark. But when you have a description of your community in your mind, you do want to think about representation. You can't have the entire universe in the room as you're making decisions. So there has to be representation. Representation, though, it's important that that be deliberate and conscious. So, for example, um, you don't want to just only sample the people who are available to come to a 10 a.m. meeting on a Tuesday. That is convenient for projects, but it is often not the best way to get a full range of perspectives. So now that you've defined your community, think about the people in it. What characteristics do those people have that may give them different perspectives on your project? What are the most important characteristics of people? And then think about who will be easier to sample, who will be easier to reach, and how can you deliberately go about making things easier for the people who are harder to reach. I think that it is given limited budgets, given limited time, it is very easy to kind of stop with numbers of people in the room. Sort of my argument here is that it's really important to also think about representation. And as you go about thinking about who it's important to have in the room, it's important to think about power. It's important to think about voices for the voiceless, and it's important to think about the politics of representation. Now, what do I mean by that? When you look at the subdivisions among your population, think about who has lots of power, who really doesn't have a lot of trouble having their voices heard, and who needs a little bit of extra boosting sometimes to have their voices heard. And how does it affect our project? Think about the people who may have trouble having their voices heard, for example, children. For example, people who are elderly or disabled and may have trouble getting out of the house to a forum. Think about people who are living with stigmatized conditions, who may not feel authorized to raise their voices. Think about people with lower education levels. Think about people with mental or behavioral health conditions. Think about people who are really busy. And just in general, think about how to raise up those voices, how to reach out and gather in those perspectives. And then think about the politics of representation. Many advocacy organizations, for example, disability rights activists will often say, nothing about us without us. And make sure that you're not making policy about people without them in the room. Does anybody have any comments or thoughts right now? As always, feel free to include them in the chat. And while you're thinking about that, I'm going to move on to doing engagement. So there are a couple of different sets of principles for how, well, like what are best practices or what are promising practices for doing community engagement. This is multiple slides. I have here 10 principles of engagement to share with you. I don't necessarily want to read through all of them, but these 10 principles of engagement that I'm sharing come out of a couple of different articles, which you'll find at the end of this presentation. I do have a works cited list if you really want to sort of delve in here more. But with the principles of engagement, so we're building on the strengths and resources within the community, not just bringing in strengths and resources from outside the community. Learning and capacity building. Particularly take note of number 3 here. Community engagement should facilitate a collaborative and equitable partnership, and that is amazingly challenging. It's also much more radical than it sounds. And So that is a really interesting challenge that often comes up in this work. Long-term processes and sharing results with all partners are cited as very important here. Engagement is not just a thing that you do and check off. Rather, it's cyclical. The diagram of engagement is often circular. You start with a project, you go to the community, you do a lot of back and forth and revisions and editing, and so it's cyclical and it's iterative. It builds on itself. Focus on local relevance. Acknowledge the community. Make sure that you are not just doing things and not acknowledging the people who are helping. And you can read through the rest of this yourself. I'm happy to talk more, but generally these are agreed upon principles of engagement. There are a couple of different models out there for levels of engagement, for depth of engagement. This is one of them. And in this one, you start with engaging, you move on to informing people, then you involve them in the project, and then you empower them as part of all of this. This is one way to talk about it. And I should also note that, going back to the principles of engagement real fast, just a point I want to make sure that I make here. Not all of these principles are required for all projects. You don't have to do every single one of them in order to do good community engagement. These things point the way. Engagement is not a yes or no thing. You're always working towards improving, and you never quite reach perfection when you're doing community engagement. So I just wanted to make sure that I added that point. So here is one model for how to do engagement and the steps. First, you start with engaging, then you give information and inform, then you find things for people to do and involve, and then empowerment happens last. This is a different model of engagement. This comes from one of our lovely clients, Community Catalyst. This is called they call this the pyramid of engagement. I think this is a strong model because not only does it show the different levels of engagement, but it also shows that at this bottom level of awareness, you have a lot more people than at this top level of leadership. So the work of community engagement, according to this model, is always trying to move people up the pyramid, starting with awareness. Are you aware of this issue? Are you aware of this project? Moving on to, are you interested in it? Do you generally know about it and have some interest? Then moving up to participation, like actually getting involved and doing things. Then moving up to commitment, having some sort of agreement or dedication to doing the work, and then finally making it up to leadership. The final point about doing engagement is that community engagement is hard work, right? Community engagement involves surrendering some control over the project. You need to work to achieve transparency. You surrender some control over decision making, and you have to slow down the process to be consultative. That is a big challenge for a lot of organizations who, timelines are challenging anyways. And then you add in all of the community engagement stuff, and it slows things down even further, and that can be frustrating. So it's just good to know going in that these are some of the trade-offs. Community engagement in general, like you all were saying when we asked about why you want to do community engagement, there's a lot of really amazing things that can only happen once people from your community of focus are engaged, and there are trade-offs. So not every project needs to be fully engaged, but it's good to be deliberate about where you are willing to go and sort of how deeply you are interested in engaging the community. So you can think about it about like where on the pyramid are we willing to go with our project. So I'm going to talk about some promising practices. Many of these things rose out of a project that we do with our client Community Catalyst, and these are drawn from a work that is cited in our Works Cited page at the end of this presentation, and this presentation will be available afterwards, so you can follow the links and get more details about that if you're interested. So promising practices for doing community engagement. We found that mentorship and leadership training is really critical for a lot of projects. Some of these things include and how to do the mentorship and the leadership training to get people up that pyramid include providing capacity support. So for example, if you have somebody who has maybe a low level of education or maybe really passionate about the issue but not necessarily familiar with policymaking circles, if you drop them into a meeting in which they're using Robert's Rules of Order and using lots of acronyms, that's setting people up for failure. So providing support in terms of preparing people ahead of time, providing support in terms of how to participate and what type of participation will really sort of set people up for success. Fostering a sense of self-efficacy. Being optimistic and authentic can really go a long way. And then investing in relationships and camaraderie. I've heard organizations say that every meeting they start with poetry. They light candles. They do things to make sure that it's a group of people who are forming relationships with each other and not just getting busy and doing the work. Because it's relationships that keep people coming back. One quote from an interview that we have this is from a consumer who was organized by an organization, and she told us the volunteers are awesome. The sense of community that they have with, the regular folks, but also meeting the people who just show up more rarely as well. But I'd say that's the main thing, is it's an amazing group of people, and it's a great space to be in, to feel like we're working towards common goals and with like-minded people. So it was really important, the sort of the lateral relationships that this consumer was making with the people that she was working with. Long-term commitment is also really important, and this is another quote from an interview with an organizer. And this organizer said, I think having this relationship continue for a significant amount of time is important. My worry is that we get a good thing going and then it falls apart because that person can no longer be in that role. That's important. Things in the United States, there's not enough time invested. It's like, well, we've got this thing, we're going to go do it, and we're going to go do it right now. And then it kind of subsides or dies, and you need to keep that momentum going. You need to keep people engaged with each other so that they can keep the momentum going. Once you build this set of relationships, it is not something that can just be abandoned and walked away from without doing damage. Another promising practice that we've observed is training the organizations, not just the community members. Another client that I have is doing exactly this, is helping family members of people with complicated healthcare needs to serve on decision-making boards in healthcare organizations. And they have a training for the family members who may never have served on a decision-making board, in order to help them appreciate how to get on the board, but also how to effectively use their time and their membership on the board to create change. But they also have a training for the organizations, for the decision makers, about how to best work with community members. And so there's talk about how to lower barriers to participation, how to use the perspectives of these community members who are coming in. There has been a lot of great feedback about this approach. I think it's really important to move people towards each other from both sides, not just put all the burden on consumers, but move towards the center from both sides. We've seen that often wins lead to wins. They set up positive feedback loop. This is a graphic that we made for our Community Catalyst project, where consumer participation leads to trust in relationships, leads to advocacy success, which leads to more consumer participation and advocacy, and the other way around. Advocacy success increases trust and increases relationships, which leads to more consumer participation. So wins lead to wins, and small wins lead to larger wins. So now I'm going to talk about the challenges of tracking and measuring community engagement. And as I'm talking, I'm going to invite you to think about some of the techniques that we've been talking about, and which ones you might be interested in using in your own work. And as we do that, feel free to comment in the group chat. I would love to hear which types of techniques feel the most doable to you, feel the most relevant for your work, etc. But as we do this, let's talk about tracking and measuring. So we're going to look at some of the following methods. Surveys, everybody's favorite data collection technique. Surveys with participants, survey with organization staff, survey with leadership. There's a couple of different types of surveys. A retrospective survey can ask participants to compare how they feel now compared with before they started this work or compared with 6 months ago, and rate how they feel now or what they know now versus what they knew then or before. There can also be longitudinal surveys in which people are invited to do a survey at time 0, at time 1, at time 2, and then their answers can be compared. Other methods for gauging community engagement is looking at checklists, is looking at self-assessments and benchmarks. And then finally, my favorite, of course, qualitative techniques. I'm going to start with surveys. And I am going to show you some examples of types of surveys. But real quick first, I want you to think about what is the relationship between project activities, engagement, and measurement. I want to know if you are doing activities to engage people separately from the things that you want those people to do once they're engaged. And then I want to know how your measurement activities fit in. So one thing that you can do is say, well, we're gonna do the activities, and that will constitute both engagement and activity. So if you're engaging people in order to encourage them to do policy advocacy, then you plan a lobby day, and the people who come, you will be building relationships with them at the same time as you are doing the activities with them. So in this case, you're on purpose sort of offering opportunities to people who are assumed to already be relatively engaged. Another way to do it is to hold activities that are relatively low bar activities. And then when people show up, so this might be tabling at a fair or sort of showing up at an event that's already going on. And then when you're there, engaging people, and then from there leading on to measurement. Or you could interpret measurement as an integral part of the project activities. So here are some survey question examples. And these examples that I'll be showing you are all examples that we've designed around here for various projects. So one thing that you can ask somebody who is serving on an advisory board, for example, or serving on a decision-making group, how frequently do the following things happen with your group? How frequently do you serve in a leadership role? Often, sometimes never. Participate in group decisions? Often, sometimes never. Participate in the decision-making process? Often, sometimes never. And how often do other group members listen to my input? So with these 4 questions, you can gauge how actively someone is participating and also how deeply they themselves feel like they are making a difference. This is a survey question that could be put to people longitudinally, for example. So if their scores of often increase over time, then that would indicate that they are becoming more deeply engaged in this work. This is a retrospective question about the trainings that somebody might have gone through in order to effectively serve on a decision-making group. So this is, do you feel your leadership skills have improved after you completed serving on groups? Greatly improved, somewhat improved, stayed the same. No, we don't give people an option to say my leadership skills got worse after we completed serving on groups. They may have, hopefully for reasons unrelated to the training, but we don't offer that option because with this survey it's already very wordy and we were really trying to cut down on the number of words. So fewer choices helped a lot with this. And then it's also asking about communication skills, understanding of the types of decision-making groups available, and then your ability to be an effective member. How much has this improved? So this is an example of a type of retrospective survey. It is a 1-question retrospective survey, so each question talks about change. The advantage of this is it's fewer questions, so less text to read, less text to process. The disadvantage is that we do not have an ability to talk about decreases, and we do not have a way to show the difference between somebody who started low and is staying low versus someone who started high and is staying high. Like those look like the same thing. This is another way to ask. So this is a sort of the template for a survey that was given to organizations. And you can see that activities here in this column, A, B, C, D, E, are activities that are organized by the pyramid of engagement. So interest, participation, commitment, there are activities that are indicating that someone might be at any of these levels. And the organization is asked to estimate the number of people in the past year who did any of these things. This is a good way to measure change over time, assuming that the reporting is accurate. There are numerous problems with small organizations, low budgets, with being accurate in reporting this sort of thing. So this is not an example of a perfect question, but it is one way that we have tried to measure change over time. Yeah, so this is just interest, participation, commitment here corresponds to interest, participation, commitment here. Sorry for the scrolling on the slides. Finally, I want to say that community engagement, especially at the empowerment level, it implies flexibility. And therefore, this presents a challenge for longitudinal measurement. If you have an organization that is doing amazing work and you want to measure it starting now and the work that they're going to do in the next year or the next 2 years, and so I say, okay, we're going to measure the work that you're going to do. You plan to do activity A, activity B, activity C. And we'll check in with you in a year and see whether you've done activity A, B, and C. and how much of it you've done. Then you get to the end of the year and you say, so how much of A, B, and C did you do? They say, nothing, because there was a policy change in the middle of our great year, and we suddenly had to go on the defense and do all this advocacy around a completely unrelated topic or a peripherally related topic. We didn't make progress on this, but we prevented this catastrophic policy change from taking place. That's a win. It's not measurable according to this metric-oriented type of evaluation. And so how do we measure these unforeseen outcomes? How can we take into account the things that they didn't expect to happen but did and were amazing? And how can we show that the fact that they didn't necessarily go in the direction they planned to go, how can we show that it's okay, that it's good anyways? What we really like to do is recommend a couple of different things. We recommend qualitative data collection for this. With interviews, with focus groups, with inviting people to keep diaries, with graphic methods for, having people relate what happened, like having people draw timelines, etc. You can really sort of get a sense of the story of what happened. You also can do continuous cycles of small changes in measurements and keep a log of them. So, for example, you can plan a set of PDSA cycles. PDSA stands for Plan, Do, Study, Act, and you say, okay, I'm going to identify a small problem. I'm going to make a small change. I'm going to do it. I'm going to see what happens, and then based on that small change cycle, I'm going to make a decision about my next change cycle. So you do one cycle, then you do another one, and you do another one, and you're making your decisions all along the way rather than at the beginning, going through the end. So these are some methods for doing it. Qualitative data is always a really great way of sort of foreseeing the unforeseen, but it's certainly not the only way that's out there. And so the way that we have approached things in the past, it relies pretty heavily on interviews and focus group type data. But as we sort of are thinking more about how to continuously improve our practices, we do think about things like PDSA cycles. So those are my materials, and I would love to have you all be thinking about community engagement and how successful community engagement might look for your organization. How can you tell that what you've done is a success? What will you see if it's worked well? I will try opening up the microphones if that is uncomfortable, or if it gets a little bit chaotic. Then we can do it via chat. But I think I'm going to try opening up the microphones right now. So if you don't want to have your sound